Good afternoon, one and all. So we're just talking about technology and some of its pain points, but I'm sure, I'm going to talk something that will probably give some positive insights into the technology. My topic today is driving change, the role of digital enablement in quality and patient care. So, in simple terms, digital enablement is nothing but empowering healthcare organizations and healthcare professionals through digital technologies, aiming at improving patient outcomes, improving efficiency, as well as improved patient engagement. We already been using and aware and well known of various technologies. It can be the digital front end technologies, patient registration portal that the patient can book appointments, order medicines. It can be a hospital information system, an EMR, learning management systems. So most of the hospitals will be using one or the other form of digital technologies in our day-to-day activities, and we would have realized how impactful it would be to have these technologies. So what is driving change? So at least from a macro perspective and an India perspective, so we need to understand that we are a very large populous country with close to about 1.2, 1.3 billion population. And for a population like us, if you look at even the estimated projection of healthcare spending that the government of India is projecting, close to about 6% of GDP will be spent on healthcare, and about 69% of people will be insured. So even these benchmarks are very inadequate, or I can say we're still not progressing well when it comes to healthcare spending as well as the population getting covered under insurance. Second thing, which is a very alarming, is the year-on-year medical inflation, which is much more than the general inflations. So that means to say that the cost of treatment is increasing every year, and this burden is passed on to the patients. And with the kind of insurance coverage, which is very much inadequate, much of the people are facing financial crisis because of this increasing cost. And this cost is not only on the patient, but even on the healthcare providers, because the cost at which they need to provide treatment is also increasing. So this is a worrisome trend that we need to realize. And apart from that, we are a country with high chronic disease burden. Close to about 50% of population has one or the other form of non-communicable diseases. It can be cardiac or diabetics, any form of chronic health issues. So it puts a lot of stress on the healthcare facilities and also invariably increasing the cost of care. We are an under-resourced country, so the number of bed to population, the number of doctors to population is quite less. So all these things, can be extremely challenging, especially if you look at the quality of care. What I mean is like access to care, the availability of doctors and healthcare facilities, the cost and quality at which these cares are given, it becomes severely compromised. And there is no other way that we have to go digital in case if we have to solve much of these problems. The silver lining has been, of course, the general usage of digital technologies has been an upstream, especially post-COVID. We are so used to using apps. This has been facilitated by the number of smartphones and the internet connectivity India is currently having. Close to about 50% or 60% of the population have one or the other form of internet connections, and they're using smartphones for be it entertainment or be it for e-commerce. So as a sort of byproduct of this usage, the healthcare consumption in form of app-based usage, app-based service for healthcare has also increased. So if you look at the data, shows a preference for online consultations, which was picked up somewhere during the COVID, is still sustaining. So close to about 50% of population in metro prefer teleconsultations even now, and this is a trend even in tier 2, tier 3 cities as well. Second thing is that during COVID, most of us became aware or got used to usage of digital health technologies like the COVID app or the teleconsultation platform. So this trend continues to remain because a lot of startups came up in this space providing teleconsultations, online delivery of medicine. So and by the consumer behavior of convenience, by offering convenience, much of these apps are still holding on to the customers, and this has actually improved digital usage of healthcare technologies. We must really congratulate Government of India for pushing digital technology to a great extent, especially with platforms like Ayushman Bharat Digital Health Mission, the National Health Authority platform, which is giving a lot of impetus to healthcare institutions to onboard. So creating digital IDs for patients, registering healthcare professionals, registering healthcare facilities. All this enablement by the government itself has sort of been a boon for digital technologies companies as well. The notable features having, the longitudinal patient health records, which will have a big impact in terms of the quality of care, because, most of the time we lose medical records, which is very precious document. And having a, ABA ID and having a sort of a digital repository of information, which is interoperable, any healthcare facility can view our records. So, the quality of patient care is going to increase. And apart from that, we're going to have a ONDC like platform, that is Open Telemedicine and E-Pharmacy Network, which will again going to bring down the cost of care, especially from the OPD point of view. If you look at even India's telemedicine service, E-Sanjeevani has already crossed over 14 crores consultations in the year 2023. So this is all sort of a testimony to the fact that the impetus from the government as well as the usage from the consumers towards digital technologies has been growing, and this is where we need to grow. Another interesting concept is integrated digital adoption. Again, these are all post-COVID inventions when large healthcare institutions realize that they have been threatened by startups, especially coming to the teleconsultation, remote monitoring, other things. They felt that, okay, they need to have something of their own. And this is where, world over, the integrated platform delivery of digital technologies came in. And one example that is very close home is the Apollo Care. So if you look at it, they have launched Apollo Pro Health that looks at screening of diseases, especially the chronic diseases. They have virtual consultations, online medicine delivery. So virtually everything they have covered. So these are examples where traditional healthcare players, the large traditional healthcare players, they're offering everything from pre-hospitalization to hospitalization, including the insurance coverage. Narayana has come up with its own health insurance. So if you look at it, even the traditional healthcare providers are moving towards digital enablement. So this is where the world is going to be. And what is the value of digital technology and data for health and healthcare? So Deloitte did a study, and then they interviewed a lot of CXO level people. They wanted to ask what would be the most important criteria for them to choose digital transformation. And the top two reasons were to improve patient satisfaction and engagement, and to improve the quality of care and patient outcomes. And this is what my topic today is as well. So how is technology helping improve patient experience, quality, and patient care? These are some statistics, which I'll not go in detail, but we need to understand that digital enablement has really brought in improvement in revenue, has brought in cost savings, and improved staff satisfaction as well as patient satisfaction. All these are published studies that I'm quoting here. And on a macro perspective, if you look at it, this is where, in Kenya, they have deployed large-scale digital enablement, and they have done studies to, and this is a World Bank study, and they realized that close to about 7 to 11% reduction of cost at a, the country level can be achieved by use of digital tools, especially teleconsultation, remote monitoring, quality management systems. So that brings me to the last, this is also what I do and which I'm very passionate about. We all talk about quality, but we need to realize this, having the traditional approach to quality management does not serve any purpose. And quality management information system is not just an accreditation management tool or an event reporting tool. It goes beyond that. So, just like how HI has evolved, quality management information systems have also evolved, and they provide an entire gamut of, services, right from how do you credential your staff to having a integrated learning management system, an event reporting system, and advanced data analytics that helps the stakeholders give you real-time information in terms of how safe is your organization. And we also have tools that empower patients to report safety. So ultimately, like, event reporting or incident reporting often gets missed because the people who have to report, they don't have immediate access to reporting, or patients don't report on their own. We are not sufficiently empowered our patients. So these are the tools, modern tools that are available, which sufficiently empowers the patient to engage with the care providers, report any incident that happens on real-time basis. These are some of the results that we have seen in our own installations. We have close to about 500 installations in 15 different countries. And wherever organizations have permitted us to, look at the outcomes, we have seen there is a considerable decrease in the paperwork. That means the administrative burden has been taken off to a great extent so that they can focus more on quality improvement efforts. We have seen an improvement in net patient scores, improvement in the patient engagements and other things. So this is where technology comes in, and technology tools like quality management and information systems comes in. And to conclude, as I said, improving healthcare will get more difficult and it will not be easier. So it is better that we adopt one or the other form of technology to improve our care delivery. So with this, I conclude my talk. And I thank CAHO for the opportunity given today. Thank you so much.
Thank you, Dr.